The government has faced backlash over the last couple of days following its decision to distribute only the first dose of vaccines that require 2 shots to confer maximum protection. The government's decision rests on evidence that a longer interval between the first and second doses promotes a stronger immune response with the AstraZeneca vaccine. Now the chair of COVID-19 immunization at JVCI has weighed in on the evidence. As ITV's political editor Robert Peston reported on Twitter, JVCI's chair of COVID-19 immunization Wei Shenlin has noted the apparent increased efficacy of half-dose/1-dose regimen for the AstraZeneca/Oxford vaccine is probably about increased gap between the doses rather than the initial half-dose. It is a welcome development for the government, which has come under fire for delaying the second dose of the vaccine. The primary cause for concern is that the protection will not be enough to mitigate the harmful effects of the virus. However, according to Public Health England, there is evidence that a longer interval between the first and second doses promotes a stronger immune response with the AstraZeneca vaccine. We will use your email address only for sending you newsletters. Please see our privacy notice for details of your data protection rights. The decision to delay the second shot has been supported by UK chief medical officers who indicated there are vaccine shortages across the UK. There are dissenting voices in the scientific community, however. An opinion piece published in the British Medical Journal, BMJ, said that the JCVI advice and the CMO's decision to delay the second dose to between 4 to 12 weeks is not based on data from the trial, but on an assumption of what would have happened if the second dose hadn't been given at 21 days, the article stated. While assumptions can be useful for generating a hypothesis, alone they are not a sufficient reason to alter a known effective dosing regimen. Vaccines are being given to the most vulnerable first, as set out in a list of 9 high-priority groups. The cohort covers around 25 million people in the UK. They are thought to represent 90.99% of those at risk of dying from COVID-19. The list high-priority groups include people aged over 80 in hospital. Frontline health staff and care home workers have been the first to get the Pfizer jab at designated hospitals, hubs and community sites across the UK. The government aims to immunise tens of millions of people this spring at over 2,700 vaccination sites across the UK. By the end of January, everyone in England will be within 10 miles of a vaccination site, or, for a small number of highly rural areas, the vaccine will be brought to them via mobile teams, according to a government statement. There will also be capacity to deliver at least 2 million vaccinations in England per week by the end of January, and all residents and staff in over 10,000 care homes across the country will be offered a vaccine by the end of their month. The statement says, "The NHS will let you know when it's your turn to have the vaccine. It's important not to contact the NHS for a vaccination before then."